Hi, this is Dr. Christopher Maloney. I'm going to be talking to you about depression. Now, depression is one of those interesting subjects that if you're diagnosed with depression, now classical depression is really over 6 months of a low mood. I typically will see patients I would classify as lifestyle depressed. They basically they hate their job, they hate their life, nothing in their life works for them, and they're depressed about it. And in that group I say, well, you know, your life is terrible. I understand why you would be pretty depressed, and actually I consider it in fact an act of sanity for you to feel down about this, and you need to really focus on altering the situation in your life that makes you feel so terrible. And I've done that very successfully in a number of patients who really have gone away from needing any kind of antidepressant because they really enjoy their life now. And there's a second group of people that really can't explain why they're depressed. It came on suddenly, it might have come on a period of months. And what we talk about in that case is, you know, are you feeling more fatigued, or is there any explanation for what's going on for you? And oftentimes depression's, you know, kind of an overall diagnosis, but we really see as a chronic fatigue kind of process. The person's getting over and over, just overwhelmed, or even like a hormonal process where the person is experiencing levels of depression that really correspond to some degree to changes elsewhere in their body. And at that point, you're really dealing with a hormonal issue, not a depression issue. The third group of people they don't really have a lifestyle reason for being depressed, or they were depressed prior to any changes, and those need some kind of support. Now, the problem I have with depression, antidepressants as a whole, is that if you read the literature, and I've got the literature all there on the website for you, if you read the literature, what you see is that they work short term, 3 to 6 to 9 months maybe. 9 months is an outlier. Occasionally I'll see a patient who's on one medication, one antidepressant, and it stays working for them year in, year out, and I'm like, great, more power to you, that's great. But what I tend to see commonly is people being moved from medication to medication, moving from one to another in terms of dosage, upping and downing the dosage. It's all over the map. And in that case, what I recommend is that they really re-examine the whole model of what they're doing, because our larger scale long-term studies have shown that people on an active placebo, which is something that would give you side effects but doesn't actually give you any of the active drug, do about as well as people on antidepressants. There's really a significant, if you will, placebo effect, but for me it's much more of a people will take care of themselves over time and find other solutions when they don't have the solution coming from a drug effect. So people who are depressed don't just sit there and wait for the drug to take effect. They're going to take whatever action they have to do that and make their lives better. So in that case, what we're really looking at is the antidepressants not being significantly effective in people's lives, the majority of people's lives, over a period of a year or two. It's not a long-term solution. If you need short-term solutions, there's a number of things you can do that are ultimately less toxic to the body and also less kind of addicting to the body. When you come off of antidepressants, you tend to have some rebound stuff, and some of the newer stuff is a combination of 2 or 3 pretty powerful medications, and in that case you're really looking at a serious rebound coming off of it, whereas some of the stuff that's available in supplemental form is much better in terms of you can come off it, go back on it, not have the side effects. So I really work with people in a broad scale of what is depression, not just a single, okay, you have a depression, here's your antidepressant. That doesn't really work for the majority of people.